This podcast is for support and inspiration only. It is not medical advice. Always talk to your doctor or care team about what's right for you. Loose skin on your arms, thighs, breasts, even your butt. In part 2, board-certified plastic surgeon and post-massive weight loss body contouring expert, Dr. Daniel Kaufman is back to break down real solutions, including his signature triple-double surgery. We're talking scars, fears, fat grafts, and why the recovery might be easier and more life-changing than you think. Stick around. What about the legs? How do
There you
those
go.
work?
So legs, now we're talking about thigh-plasty. So in the thighs, we have essentially, again, more options. But when we're talking about the thighs, we're talking about another kind of accumulation of fatty tissue that creeps up in there. A term that people have used is lipedema. Now, lipedema is this really hard and very very tough kind of accumulation of fibrous adipose tissue. So it's fatty tissue, but it's combined with a lot of fibrous elements that makes it really tough and could start basically at the hips and go all the way down to the ankles. It actually can happen in the upper extremities as well, but lipedema is mostly used to describe that fibro fatty accumulation in the legs. And boy, it's a problem when we face it. So oftentimes
Because
we
it's
have
even hard to lose while on your weight loss journey. Like you'll
right.
lose
And
all the fat around it, but the lipedema is still there.
exactly. And that's one of those descriptive elements of lipedema that even despite the massive weight loss that many people undergo, that accumulation in the thighs and going down to almost all the way to the ankles, yeah, and that becomes really, really tough. And yeah, and a lot of people get discouraged by that as well. They can't wear skirts, shorts, and so forth. Now, with those situations, oftentimes what we have to do is serial liposuction, which means we have to do liposuction in several stages. So you might, before you even get the thigh-plasty, which is a form of lipectomy where we cut the skin away, not just the fatty tissue, but the excess skin, you may have to get several episodes of just strictly liposuction. And again, the reason why is because that accumulation of fatty tissue is so tough and recalcitrant that it kind of beats all the efforts that we have at weight loss, even bariatric surgery and endoscopy. So it's a real tough problem in the lower extremities. Now, getting back to when you actually do have the excess skin, we can think of the thigh as essentially encompassing two elements. A horizontal element, which really isn't horizontal because it follows the groin crease along the perineum, which is that bottom portion of the groin. And let's get a little graphic. Why not? Between the vulva or the genitals, right, or the scrotum in a man, right, and the anus, which is obviously where things come out, right. So at that bottom area and along that buttock crease, that's what we would call the horizontal element. Beyond that, we can think of the vertical element down along the thigh. So most thigh plasties today, and there's a few versions of them out there, but the ones that are most comprehensive encompass the elements of both the horizontal and the vertical element, which means the scar will start somewhere in the groin, potentially extend into that perineum, into the buttock crease, and go down the thigh. Now, before everyone gets
Sounds
scared and
awful.
say
I'm not gonna lie, because that
it's
sounds awful.
actually well, maybe to some, yes, but I'll tell you what, you haven't seen my scars because the scars that we do these days, right, and the scars that I particularly do myself, I use the technique to make sure that the scar placement is the number one issue with bariatric plastic surgery, which is, essentially what we're talking about here. The scar always has to be placed on the inside of the thigh. And that way, when you wear shorts, when you wear a skirt, when people are looking at the front of your thighs, they see no scars. When they look from the back, they see no scars. Only when the legs are open is when you can see those scars. When you're essentially completely disrobed is when those scars become visible. So that's the essence of doing a proper thigh-plasty. And, I forget where this comes from, but, and I guess an old saying is to make an omelet, you got to break some eggs. So we have to be able to withstand the scars that are going to be there if we're going to do the massive improvements in the contours. And in bariatric plastic surgery, contours always beat scars. That's something that we have to acquiesce with, we have to agree with. There's no other
Mm.
way to do it, unfortunately. We don't have a machine to shrink up the skin, no matter what the laser lipo and the j plasma and the radio frequency, the body type, these all these machines that purport to shrink the skin, they just can't do it well enough when we're talking about massive excesses of skin. Unfortunately, there's no pill, there's no exercise to take away that excess of those excess folds of skin. The only solution is surgery, which means if we're going to cut it out, we're going to do a lot of cutting. As soon as we said a moment ago, we're going to do a lot of
Mhm.
sewing, and the scars will be
Mhm.
there. But if they're placed in the appropriate location where they could be hidden away or made as inconspicuous as possible, then that's properly done bariatric plastic surgery.
Yes. And so what about the arms? Because I know that's probably I remember you saying bat wings. You mentioned that earlier. What's that about?
Yeah, so the arms are essentially very similar to the thighs. So the formal operation there is called brachioplasty. Plasty, obviously, just that Latin root for changing things. Brachio referring to the arm, and again, the essence of doing properly of properly doing an arm lift is or brachioplasty is to make sure that the scar ends up on the very inside of the arm, so that when you're wearing a tank top, a t-shirt, something revealing, even a bikini top, and your arms are in repose, they're just by your side, you will not see the scar from the front and you will not see the scar from the back. It's only when you open up and wave hello
Mm,
or the arm is
right
opened up,
underneath.
that's when the
Hmm.
scar will be visible. Now, oftentimes you refer to that batwing operation, right? That's an operation that was actually, the term was coined by probably one of the world's first superstar plastic surgeons. Dr. Patangi is a Brazilian plastic surgeon, passed away a few years ago, but in the 60s, he actually combined this operation, the brachioplasty, with a thoracic roll lift. And thoracic refers to just the chest or the side boob, people call it sometimes, the side of the chest here, and actually combine it with a breast lift as well. So if you could think of, it's essentially three operations all in one. So it's an arm lift, a thoracic lift, and a breast lift done all together. I like to call that operation my triple double because I do three operations on both
On each
sides. So
side.
we get, yeah, exactly, right? So we get that once continuous scar starting from somewhere around the elbow, sometimes even extending beyond it. Again, depending on how much excess skin you got. And, you know, I've seen so many different cases. The anatomy is just as varied as the people that come, seeking my help. So how far the scars extend and where they go and how we decide to kind of what procedure to do and when to do it, where to do it, all of that is an individualized choice. So that batwing operation, again, that's one of the most elegant and powerful upper body contouring operations that we know to do today. And again, that's not the only things that's there are more options to extend into the upper back, and we can combine this with a lot of women actually, they lose volume, they lose shape of their breasts. So we can combine this with implants for augmentations. We can combine it these days with fat grafting to the breast. Some guys like to put some
So
fat
that's
grafting.
a thing.
Absolutely, it's
Cause
a
that's a
thing.
thing. Cause I lost all my boobies. I'm gonna be honest. I have no boobies. And I was like, but I don't want implants. Can they put the fat in my boobs? I didn't know if that was like a possibility.
100%. Absolutely. That kind of stuff, the fat grafting to the breast actually used to be frowned upon many years ago. About 1,000 years ago, when I was training in plastic surgery, you couldn't even speak of that. But
Hmm.
these days, obviously, because of all the advances in surgical techniques, fat grafting, the same way as it's done for the buttocks, as in the famous BBL, we
BBL.
can now
Yeah.
these days do it for the breast as well. And it's a wonderful option for augmentation if you don't want that foreign object in your body, the breast implant. And nothing wrong with
Hmm.
doing implants. We do it all the time. And I've done thousands in my lifetime. And millions of women around the world have had breast implants implanted into their bodies with fantastic results. But some people still don't want those foreign objects and the potential problems that come with them. So these days we have a wonderful option of fat grafting. instead. Now, we can actually combine the fat grafting with all the different body contouring procedures that we do. So, for example, if we're doing a breast lift, whether we combine it with the thoracic roll lift or the arm lift for that triple double bat wing operation, we can do implants or we can do fat grafting. For the buttocks, let's say when we're doing the belt lipectomy or that total body lift, if you think that your buttocks have lost volume and shape, why not? We're doing a bunch of liposuction with the lipectomy, take some of that fat and fat graft it into the areas where you want for additional volume and contouring. The options abound, and Jatoya, I can't say this enough. There are so many things that we can do these days that us
Yeah.
post-massive weight loss body contouring surgeons can do, and so many people don't know about it, both patients and doctors. And it's up to us to talk about these things, to bring it out to the light, to not be embarrassed and not be afraid to talk about it. If we want to get it done today, we can restore our contours, we can get back to our former pre-obese selves. And it's something that again, you'll find me preaching from the mountaintops, just yelling every day and as loud as I can to let people know about all the options that they have.
Yes, it's more than just tummy tuck these days, but that's usually
Yes.
like all you think about. And I wonder, is that because of insurance? Because most insurance, if they do cover it, is usually just the general tummy tuck. Is that correct?
Yeah, so it's actually not exactly the tummy tuck. What they would cover is an operation called a paniculectomy, which is a
Mm.
horrible operation, which doesn't address nearly the problems that need to be addressed with an appropriately done tummy tuck or extended tummy tuck. Here's the thing. The way that things are today, the insurance companies, the healthcare insurance companies are very reluctant to pay for these kinds of body contouring operations. Now, whether that's a good or bad thing, again, that's a discussion we can have that could last, maybe that's for another show at another time.
Yeah.
But the way it is right now, there are very few operations or surgical or plastic surgery operations, rather, that insurance companies are willing to pay for, like breast reduction and lift. Those we can, get covered sometimes. Or, as you said, certain parts of a tummy tuck, the paniculectomy part, they can be used to do that. But I still think and I know that these days we're still on our own, and a lot of this has to be an out of pocket expense. Now, the
Mhm.
bad thing about that is you say, well, yeah, that limits a lot of people's options. But on the other hand, there's another way to look at it, as the good part about it is that, you know what? Well, people have to make economic choices. And a lot of healthcare, we don't want to admit it, but it actually is an economic transaction between a patient and a doctor. And there's a lot of good that can come out of that as well, because people are forced to make better decisions. They're forced to make the appropriate choices in their lives and come up with the best solutions, because the first rule of economics is that scarcity rules the day, right? There's never
Yeah.
enough of everything for everybody. So
Yeah.
you got to make choices in life. And a wise man once said, to life's problems there are never any perfect solutions, only exchanges. So
Mm.
it forces you to make those choices. It forces you to be realistic with yourself and figure out logistically, financially, what we can afford and how we move forward. And you know what? Yes, there's some bad issues to that with the non-coverage with insurance, but there's a lot of good that comes out of that as well.
Mhm. So after the surgery, whatever the surgery that you decide, just typically, let's just say we're just doing the core. What does the recovery look like? Is it just a couple of weeks, a couple of months?
Yeah,
How
so
does that
usually for
go?
most people, it's a week to 2 weeks, and most people are back doing their mostly their regular activities after that amount of time. We do have some drains that we need to extract, and those usually get taken out within the first week or maximum 2 weeks, and that depends on a lot of different things, factors with the patient, with the doctor, of course. And the key to this, and I alluded to this earlier, the best way to do post-massive weight loss body contouring is to do it in stages. That's to say,
Mm.
pick the best area or the worst area, as it may be, but the worst area of your body, the one that you want to handle in the best way, or the first thing you want to do, pick on that, do the best you can, do as much as you can, and then live to fight another day. And that forces you to limit the surgery to very specific parts of the body. Now, because of that limitation of the amount of surgery that you're going to undertake, well, then you're going to be moving around a lot quicker, a lot better. And that's the essence of ambulatory surgery. Now, I've dedicated my professional life to this kind of surgery, the ambulatory surgery, meaning surgery you walk in and walk out of. You do the surgery in
Mm.
one day, hopefully in an ambulatory surgery center or in a hospital, but you don't stay overnight in the hospital. You actually recover at home, or if you're traveling for surgery, at your hotel, recovery house, Airbnb, where have you,
So kind of
and you
like
get
outpatient.
Exactly, exactly. So it's outpatient surgery. That's another way to call ambulatory surgery. So surgery you come in and come out of that same day. Now, that's the safest kind of surgery that you're ever going to do because, well, it forces you to be safe. You can only do so much and be able to
Mm.
walk away from it. And that means less blood loss, less of the systemic inflammatory response that all of our bodies experience after surgery, less chance with lower operating times. Virtually all of my operations these days are less than 4 hours. I mean, I rarely do operations that are 6 hours or more. And that's what it would
Mm.
really take if you want to do the belt and the breasts and the arms and all these things that some of my colleagues on Instagram, they show that they do these massive reconstructions, but at what cost? And I don't mean just
Mhm.
the monetary cost to the patient, I mean the physiological cost to the patient. All that blood loss, all that time on the operating room, surely your chance of getting a blood clot and potential blood clot traveling to the lungs, the pulmonary embolism, the dreaded complication of pulmonary embolism, which could be devastating. It could actually even be fatal. With doing ambulatory surgery, with doing a limited amount of surgery, we limit all those complications, and we definitely bring the rates down to an absolute minimum, and it makes it a lot safer.
If this is hitting home, go ahead and follow the show. And if you haven't already, join the Facebook group Bariatric Paths, Your Journey, Your Tribe. You can also sign up for the email list at bariatricpaths.com for updates.
Now, one of the most important things that people overlook, and just to bring this point home, is why we like to do staged surgery, is because after every one surgery that you do, your body image, the perception of your body, the way you look at yourself in the mirror is absolutely going to change. And
Mm.
things may become apparent that maybe weren't apparent before. And vice versa, things that maybe used to bother you so much before
It's
now
not that
may
bad.
not bother you at all because you found that they've been already kind of taken care of, whether directly or indirectly by the previous operation. So it gives you a chance as a patient to reassess, to kind of reconsider what's important to you with your body in your life. And it makes you a better decision maker as far as continuing along this journey to full body circumferential reductive restoration. So I'm a proponent of that, of ambulatory surgery, of stage surgery. I think it's the best way, the safest way. Economically, it's the most feasible way because you can pay for one surgery and then live to fight another day, kind of get
Yeah.
to reassess your finances and then figure out, okay, well, what's important to me? Maybe I don't want the breast implants now. Maybe I thought my thighs were horrible, but now that body lift really took care of the thighs in a wonderful way. Let me see about those arms now. So you get to kind of hone the plan in a much better way. And if you got a good surgeon, a board certified surgeon, a body contouring expert, you can have that discussion, and not just one, but multiple discussions over some time, over months and even years, and you develop a relationship, this is one of my favorite parts of doing this kind of surgery, is because I get a chance to see people blossom, not over just one surgery, but over a series of operations. And I could really be part of their journey to complete restoration of their pre-obese state. So that's the way to do
Mhm.
it, and I'm sticking to it.
I could tell because even earlier when you were showing me all of the little gadgets and gifts that you've received over the years from your patients, and I said, I loved my doctor, but I didn't give him anything. So it's like you have to have that kind of connection for someone to really want to be like, I want you to have this, like you've done some life-changing work with me, and I'm appreciative of that. So I could tell like you definitely make sure you develop those relationships with your patients. And I absolutely love
Absolutely.
that.
Yeah.
It makes it a little less scary because that gets to my last question. So, what would you say to someone like me, because this is me, who wants surgery but is terrified of that recovery piece of it being like too painful or too evasive because we have a scar now right there in my crotch. So how do you help them through that fear of like it's okay? Because to me, I've always said, even though I had a major surgery with the bypass, I ended up with like 5 little stitches. And so
Yeah.
now you're saying like a whole scar across my entire hip. That just seems a lot more painful. So what do you say to patients like me who are nervous about that factor?
So I guess don't be. I mean, this is just that's my, that's my. I guess that's the biggest message I can impart on people is definitely explore the options. No one's forcing you to do anything. Figure out what it is that you're willing to withstand in terms of the scar burden. As you said, can you tolerate that bikini cut scar? And if you can do that, can you tolerate the vertical scar? And if you've already committed to that, can you tolerate the scar going around the body? You have to realize that, as I said a moment ago, there are no cures, there are no medications, there's no exercise, there's no machine or energy delivery device that will get rid of all of the excess skin. And unfortunately, here we are. If we got excess skin and tons of it, we got to do some cutting and sewing. And to make an omelet, you're going to break some eggs. So you're going to have to withstand at least some of those scars in body contouring. So that's the number one message. But I'll tell you what, and this goes back to the reason why I got into plastic surgery and why specifically I got into post massive weight loss body contouring surgery. You ready for this?
Yes.
You, whoever's watching this, and you, Jatoya, you are the best comeback story in all of medicine. I mean, I can't think of any better story, that comeback kid. I mean, to think of where you've been. And I've heard so many stories from so many patients of mine being down in the dumps for one reason or another. They got into the obese state, whether it's, the loss of a loved one, losing a job, relationship difficulties. I've heard it all by this point in my career, and the stories just keep coming. And yet, people who have lost massive amounts of weight, they've all conquered those internal demons. They've all done so much for themselves to get themselves out of the rut. And they've all decided, whether it's over one day, or over years, they've said, you know what? I've had it. I've had enough of being in this state. I want to restore my body, restore my contours, and by direct extension, restore my mental sanity and solace. I'm telling you that the story of the massive weight loss patient, when they tell me how they've done the weight, and so many times it's a convoluted story of losing the weight and gaining the weight, and I did a sleeve and then converted to bypass, or I was on Ozempic and it worked and didn't work, and all these stories. And eventually, when they make it to see me, and we're talking about all the different options that we have, it's glorious. It's just an amazing story. It's the ultimate comeback kid story. And who doesn't love an underdog? I mean,
Yeah.
it's what great novels are written about. It's what makes those, famous Hollywood films. It's just an amazing thing to see. And for me to be part of that, journey, and seemingly only on the last part, but not at all, because it's a lifetime struggle for so many people who are fighting obesity and dealing with all the medical problems that come around with obesity. It's just a wonderful thing. And for me to be part of that journey, it's just great. And if I can inspire you just a little bit to take that extra step and go with it and do whatever it is, the surgery that you're willing to do, and there's likely going to be many others. So many people see all the benefits, again, not just of the physiological benefits to the body, but the mental health aspects of restoring those contours of the body. And the fact that it actually helps in staving off the obesity regain, I mean, it's all positive for me. So I just try to encourage people and tell them, you don't know what you're missing, because it may seem dark. There's, very bleak times where you are right now, but I assure you, there's a light at the end of the tunnel. And if you're willing to take those steps along with me, man, I'm here for the ride. So it's a pleasure. It's an honor for me to do this kind of work, and I just love it. And if I can convince people to get it done, more power to them. And I commend them for the effort.
I mean, you're really convincing me. Making me think like maybe I'm not gonna go see Beyonce in Paris. I might go get me have a procedure instead.
Well, you know
But
what? If at least if I've convinced you to at least consider the options, well, you know what? I've done my job for the day, and that's a great
yeah,
thing.
because I was an absolute no, I'm not doing that. So you're now looking at me like I'm thinking about it for sure. So for other people like me that are kind of thinking about it, where can people learn more about your work if they want to actually be one of your patients? Where can they find you?
I'm all over the internet. I guess the easiest way to do it is just go to drdanielkaufman.com. That's my website. That's DRDANIEL, K as in kilogram, AU, F as in Frank, MAN. So Dr. Daniel Kaufman, drdanielkaufman.com. And there you can get to all my socials. I got a few Instagram channels. I got TikTok, all that stuff. I guess there's a bunch of Facebook groups that, support groups with patients that talk about the services that I deliver. I work here in Miami, and plenty of people come to, they travel from all over the United States and all over the world, as a matter of fact, to come have surgery with me. So you can find me on the internet, and yeah, that's where I'm at.
Thank you so much, Dr. Kaufman. This has been a fabulous interview. I definitely appreciate you coming and talking to us. We absolutely loved it. I'm happy.
Thank you so much, Shatoya, and thanks for all the viewing audience, and go for yours. You can do it.
Yes, and we'll be sure to put all of your information in the show notes so our audience can go back and follow up with you if they would like.
All right, thank you.
Before you go, make sure to subscribe and hit the like button and share this with someone walking their own path. Join the Facebook group Bariatric Paths, Your Journey, Your Tribe, and sign up at bariatricpaths.com to get all the details on upcoming events, support, and more. We're in this together. Go out there and crush it.
This podcast is for support and inspiration only. It is not medical advice. Always talk to your doctor or care team about what's right for you.